So just find a comfortable seat. Just take a few breaths. We're going to explore a few poses, movements, some self-massage to support in pregnancy. And it really is nourishing to support the changes and the huge transformation that happens as you grow and nurture your baby and your own needs in pregnancy, to really help prepare physically, emotionally, and mentally for birth and for motherhood. So, we're going to start with a little bit of self massage. So, just sitting in a comfortable position, whatever that looks like in your body. You can also sit to a chair and just giving your foot a little massage. So, holding onto the sides of the foot and using your thumbs to massage onto the sole of the foot, in between the toes, giving the foot a squeeze, but working all the way to the heel. And it's really nice to release the ankle joint and squeeze the heel and roll through the ankle, giving it a shake and just building some mobility there. And then connecting with the other leg and foot. And you can use props to support. And really we're connecting to our soul, the soles of the feet, the soul of the world. So really important, this connection pathway through the feet, where really we're mapping out the whole body through the soles of the feet, connection to the pelvic floor, the diaphragm, the throat diaphragm, beneficial to supporting our sense of grounding and connection to our body and our baby, and the birth canal and the connectivity of the whole system. To honor that, we're going to connect with our breath. So again, just a comfortable seat, and you can change position as often as you need to. It's great to change position. So we're going to just breathe down to baby. So you really want to feel a sense that you're breathing and expanding all around the side body and the back of the waist as well. And then just connecting as you take a few more breaths, feeling that expansion like you're filling from the lowest lobes of the lungs, now filling up into the side body and the back of the rib cage, the back of the diaphragm. So by connecting more through the side body and the back body, we're reducing the pressure on the linea alba that runs up the front line and impacts diastasis recti and that separation or widening of the rectus abdominis muscles. So take a few more breaths up into and around the chest. And when you're feeling tired or nauseous, it can be really helpful to just focus on the breath and finding a fuller, deeper breath with ease, no strain. And you can take an extra sip of air at the top as you breathe in and up. Just taking a few breaths, leaning to the side, and again, really visualizing that space between the ribs and just seeing if you can mobilize a little more there. Really connect on fuller breath and more mobilization through the back and the sides of the rib cage and those secondary respiratory muscles. So just releasing, taking your hands now down to baby if you wish. Palms rest at the abdomen, or you could take Yoni Mudra, index finger points down and other fingers interlink. And just take a few breaths here, connect with your body, connect with your baby, send some love to your body and your baby with your breath. And just check in with what your body and your baby are communicating to you, what your breath is communicating to you. So all of this is a practice of awareness and building connection and presencing to what is happening in the moment. So we're going to come onto all fours. Take any padding you need under the knees, and you can raise the forearms and rest them to blocks. You can also rest to a ball. So this is helpful if you're feeling nauseous. You want the head to be higher than the heart and the hips. Taking a few breaths, you can cat-cow the spine just very gently. You can do cat-cows on all fours or with those forearms propped if you've got carpal tunnel or sore wrists. So big breath to bloom into the back space and round through the upper back. And then lengthening the spine and not dropping baby down, but just finding that sense of length, heart reaching forward, butt bones reaching back, but not collapsing into the lower back. And then you can do a few flipping the breath the other way, exhaling as you round through the upper back and inhaling back to that neutral spine. We're going to rock back Toes tucked, and then bend the knees, forearms rest to thighs, and slowly work your way up. Always taking time with the transitions, as important as any shapes or movements that we're making. So we're going to massage again into the feet using a massage ball this time. You can use a tennis ball. I've got a spiky ball here. So again, we're really waking up the soles of the feet. This can be so helpful in early labor as well, when sometimes the excitement or lots of feelings and emotions can come up, and anything that can help to ground and earth us and make us feel more connected to the earth and the earth of our body and our baby, super helpful and nourishing. You can roll from the toe pads to the heel, then kick the ball forward and continue rolling down the foot, and then put both feet down, close your eyes and feel. Notice any sensations or differences between the sides, all the way up through the leg to the pelvis and maybe beyond. So having a massage on the other foot, scribbling, working to all the parts of the foot. You can roll from the toe pads to the heel, then kick the ball forward. And this is following the lymph and venous drainage along the sole of the foot and then up the back of the leg. So really boosting that circulation and blood flow with this gesture too. And then just feel with both feet earthed. And throughout the day, it's really great checking in on posture at different points. So you can explore just from standing a little tuck of the pelvis. So tuck your tail under up and then sing your butt bones back and up. Feel those extremes and then see where kind of feels like neutral for you, the space between those. The way we can measure where our center of gravity and weight is, holding a band or a belt to the side of the hip at the top, letting it dangle down. And you want to see where the base of the belt rests. We want it to be roughly over the ankle joint. If it's further forward over the toes, it would suggest the pelvis we're leaning forward. The belt hangs towards the heel. Our center of gravity is back. So it's a super helpful thing to just check in with through the day so that you can build that awareness. What we're trying to find is pelvis aligned with ankle joint and shoulders aligned with pelvis and ankle joint and the back of the skull aligned with the back of the rib cage. So again, it's a feeling practice, but they're points you can check in with day to day. That we support that alignment, that transfer of weight through the body, the more that we support the body through these changes. So we're going to stretch through the calf muscle and the back of the leg, raising one foot on a block. Here it's really important that we lift the butt bones skyward. We bend both knees to start with. The foot that's not on the block is further back. And then you can explore finding more length in the legs or keeping the knees bent. Making a pillow supporting the head, and the spine is long, and if I'm feeling a bit nauseous, I just make sure that my torso is parallel with the earth and I'm not forward leaning. Take some breaths, and then I would just lower the support where I'm resting my arms.
And just try here, taking some deep breaths through the nose and exhale out of the mouth like you're fogging a mirror.
I'm going to come up and swap sides, just noticing the difference.
Just shaking out the legs between sides.
Keep thinking about your butt bones arcing to the sky. Long spine, lots of space around the chest.
Smooth breaths, inhaling through the nose. Exhale through nose or mouth.
Releasing pressure and tension through the lower leg, feet, ankles can really help to support pressure management up through the body, particularly around the head. So if you get headaches or tension there, a great place to check lower down in the body, and it can really help to relieve that sense of pressure further up. So we're going to come into a lunge from here. This is a great thing to do regularly, and really the focus here is opening up the front of the pelvis and working with the psoas muscle complex. So I've got my left knee bent, my left foot forward, my right leg is lengthening back. But what we're going to do here, you can lift the arms up or use the chair. You're going to bend that back knee and imagine it scooping forward towards the chair or towards the front leg, creating the pathway to really breathe into the thigh, the front of the pelvis, and the psoas muscle that connects to the top of the leg bone and all the way up to the diaphragm. And it travels front to back, and it's the main influencer of space in the uterus. So, really, an offering to create space for baby in their beautiful sattvic womb world. You can lower the knee and do all of this on a low plane, or you can explore a few breaths, just coming down, rocking backwards and forwards, or find lots of length through the torso if you're feeling a bit nauseous. Then you push off the back foot, lift the back knee, and move forward on the exhale, paralleling the feet, and then swapping sides. So this time I'm stepping the left leg back, finding my balance. I can use anything to support. I can also use a ball when I'm doing standing poses on days where I might be feeling tired or just want to conserve energy. If I'm feeling sick, this can be really helpful where the energy is lower and we don't want to overstrain the system. So elbows overhead gives a little bit more work for the diaphragm. So you might not need that. You might like the lengthening through the side waist and side body. Again, bending the back knee. So bending the back knee and imagine it scooting forward. You can do pulsations or you can take some breaths and just hold it in that position, really opening through the front line of the thigh up to the front of the pelvis on this side. You can lower the knee down, slowly using your support of the chair and find stillness. You can rock forward and back here in low lunge. If you've got any pelvic girdle pain, keeping the front knee parallel with the back hip rather than winging the knee out to the side is going to help support the integrity of the pelvis there. So we're going to just step back for a moment and we're going to come into a squat. So there's lots of options. If I've got a breech baby or I know baby is breech, I want to stay high in my squat. I want to stay up high and sit to a chair. I don't want to. Equally, if I'm a lot further on in pregnancy or squatting is just not something that I've done very often and it's not familiar in my body system, I can start on the chair. So don't ever want to strain. I want to lift my butt bones back. So imagine them drawing back and up towards the sky. And you can explore this on the chair and doing little tilts, rocking and then tucking the butt bones under and then arcing them back till you find that place where you feel that lift of the tail. And just taking some breaths here. We're going to do a few breaths with sound. So taking a big breath in and you're going to breathe that sound down to baby, down to the pelvic muscles and feel this sense of creating space there. So, and we'll do the vowel sounds. Take a big breath in. A, E, I, O, U. And then just finding a comfortable seat. You might want to stay as you are or coming back to resting the hands to baby or into yoni mudra, womb mudra. So a hand gesture to support connection to your womb and your baby. And the offering is to just finish with a few humming breaths, Brahmari, bumblebee breaths. This works with vagal tone as well, so very soothing. Very nourishing and supporting releasing tensions. So go with your breath, your imagination, and your awareness to really feel in this sense that this is a sonic massage and lullaby for your baby, your body, and releasing any tension around the pelvic muscles, the muscles around baby and the uterus, and anywhere else you might be feeling tension. And you can stay here resting and connecting with your baby for as long as serves. So wonderful to create that time and space, even if it's a minute. Connect and listen without needing to hear an answer or something logical. Being connected and aware to the communications of your body and your baby. and your breath. A few humming breaths here. Just taking some time here, if you have it available, to just connect a little more with your baby and your body and your breath. Deepest respect and love